Hey everybody, welcome back to the Teach Back Method, where I teach you guys something I'm learning about in grad school to help me understand it better. For today's video, we are going to be discussing glenohumeral instability, what our signs and symptoms are, what special tests we may use to diagnose it, etc. Let's break it down. Before we dive deeper, there are 4 different classifications of shoulder pathologies. The first one is what glenohumeral instability falls under, and it is the hypermobile/unstable shoulder. The second category is just the opposite, so it's hypomobile/stiff shoulder. The next one is impingement, and the last classification is degenerative. Now, when our patient comes in and they have glenohumeral instability, they might be reporting a couple things. So our subjective finding is what our patient is reporting to us. Here's what they might say. They might say, hey, I have some looseness, or it feels like my shoulder is slipping out of the joint. And there could also be a possible history of trauma, although that is not always the case for glenohumeral instability. The next thing I want to talk about are the interventions that we would use for this patient. First and foremost, we want to stabilize. This makes sense because this is an instability problem. So when we find instability in a joint, we want to strengthen it. Particularly, we want to work on the scapular muscle stability. The next thing are joint moves. Now, we will perform joint moves if we do find this limitation in the posterior capsule. There are 2 more things I would like to discuss. First off, what is the patient population we should expect to see when we're looking at glenohumeral instability? For the most part, we are looking at active individuals under the age of 40. And then secondly, I previously stated that we want to stabilize, and that should be the main intervention for this patient. So, what specifically should we stabilize? We're going to stabilize 2 things, teres minor and infraspinatus. Now, I do want to say it's important to stabilize a bunch of things and work on many muscles, but this should be the primary focus. I hope you guys learned something about glenohumeral instability. Come back to my page to learn more.